So what is diet and what is nutrition? So diet is the actual food that you consume. It's what you eat. Nutrition is the absorption of that food and the nourishment to support your life, and it's how you eat. So if you think about standard anatomy of the GI tract, you have your stomach. And so if you think of that, that is basically like kind of like battery acid, right? So those gastric juices are going to mix up those foods and start to break them down so that when they get into that small intestine, and your small intestine is about 20 to 21 feet long. And so again, if you have, we'll talk about the different, where your disease is located and where you might be malabsorbing. And then if you think about your large intestine, I like to say that's basically like a sponge. So that's going to help to reabsorb that fluid and help with some of the different nutrient absorption. So this was a slide courtesy of Beth Wall, who's the other registered dietitian at University of Chicago. I really like how this helps to show where different nutrients are broken down. And with many of my patients with Crohn's disease, they have disease in the ileal area, so whether it's ileocolonic or just in their small bowel near the ileum. And as you see there, there's a variety of vitamins and minerals that are broken down there. So many of our patients need to be on B12 injections, and we like to check their B12 levels. This is what can cause a lot of fatigue in many patients. So again, every patient is different. Everyone has their own trigger foods, and no one is the same. Common foods that may cause discomfort in patients include high fiber. So you might have heard from maybe your physicians to watch out for fiber in different foods. We'll talk today about manipulating some of those fibers to see how you can possibly incorporate them when you are in remission. High-fat foods. So many people will note after they go out for some greasy food, fast food, whatever it might be, they might have a rush of symptoms and might have a lot of loose stools. So some patients are sensitive to high-fat. Caffeine, that's a pretty obvious one, but a lot of patients don't think about that. I have patients that come in and they're taking 2 to 3 Red Bull a day and a couple cups of coffee, and they don't think that that could be affecting their bowel movements. So again, there could be some very simple modifications that you can make in your lifestyle that can change some of your symptoms and help your quality of life. Alcohol is another obvious one. Even someone with a completely normal GI tract might have issues after consuming alcohol. Dairy, today we'll discuss some of the different issues. Mainly for most people, they'll have issues with the lactose portion of the dairy, and that's what can cause the gas and bloating. But there are a variety of dairy products that people can consume that do not have lactose. And then spicy foods. That's pretty obvious, but some patients just have to avoid a lot of spicy foods. It could be spicy coming out the other end. I'm sure some people have experienced that in the past. So again, what do we know? There is no scientific evidence at this time yet that food is going to cure IBD. Now again, another patient population of mine is celiac disease, and that is a specific diet for celiac disease. Again, we'll talk about why some patients might feel better on a gluten-free diet today, some of the things that might be driving those symptoms to reduce. And again, if you think about, sometimes patients will go online, there might be misinformation, or they'll take something, specifically, and they'll restrict their diet quite restricted. And so what happens is a lot of times the nutrient deficiencies can occur, poor healing of the GI tract, and can actually worsen symptoms if patients don't really know what they're doing. Again, as I mentioned, the diet should definitely be individualized. Everyone's food intolerances vary. And there are some foods that we'll discuss today that can reduce some of your symptoms and allow you to live a happier and a healthier life. So there was a survey done on 244 patients with inflammatory bowel disease, and they asked them why they thought diet was such a hot topic with IBD. Approximately 16% of those patients felt that the diet caused their IBD. 40% believe that certain foods cause their specific flares. About 47% of the patients noticed that it changes the pleasure in eating. And so again, this can cause a lot of different issues surrounding meal times, social life, and also 66% of these patients report avoiding specific foods to prevent their flares. So again, there needs to be much more research, but it is very certain that the dietary beliefs and the behavior have a strong impact on those with the social life of those with IBD. So everyone wants to know, what could have caused my IBD? What is the risk? There was this study that looked at this paper that looked at 19 different studies. So again, this is a pretty extensive one, but it was retrospective. They looked at what these patients were consuming, and they found that a high intake of meat as well as a high-fat diet was associated with an increased risk in IBD. A high-fiber diet and a diet high in fruit was associated with a reduced risk of Crohn's disease. And again, as Dr. Rubin just mentioned, this could be, again, an association just because of these patients that have Crohn's disease might just not be eating fruit due to the symptoms that they're having. And again, those with a high intake of vegetables had a reduced risk of ulcerative colitis. So again, this did not look at specific foods. It was very generalized, but this is one of the studies that's looking at those risks of IBD. There was a excellent survey done with the CCFA, and they looked at almost 7,000 patients. And this was an open-ended question survey, and they looked at what patients believed caused their symptoms. So most frequently, patients reported that yogurt, rice, and bananas helped to improve some of their symptoms when they were having a flare or having just looser stools. And again, as you could see there, the foods that worsen those symptoms is quite varied. And there are many of those other foods that I just mentioned, whether they're fruits, vegetables, nuts, red meat, dairy products, popcorn, again, some of those insoluble fibers that we'll talk about in a bit. So again, this was self-reported, and this didn't look at measures of inflammation, but this was recorded almost 7,000 patients, as I mentioned, of what they believed exacerbated their symptoms. So again, many patients come to me and they want to know, what should I eat? As I said, everyone's very different. We like to look at the location of the disease. So often I will pull up the pathology and review where they have the inflammation in their, whether it's their small intestine, their stomach, because again, as we know, Crohn's could be anywhere from your mouth all the way to your rectum, and ulcerative colitis is just in that large intestine. So I like to really educate and let patients know so they're empowered to know where their disease is and they can understand, as Dr. Rubin mentioned, what is the root of some of their symptoms and how they can improve that. Again, if somebody has stricturing disease where your intestines get very small, or fistulizing disease where you have a tract from one organ to another. So we want to look at these things when we're looking to see how to optimize their diet. Again, does somebody have constipation, or do they have diarrhea? And are you in a flare or are you in remission? Because these are things that are all something to consider when we're looking at the diet.